Hello, today I'm going to talk about the history of rheumatology at the Brigham Women's Hospital and really talk about the history of the Robert Brigham Hospital and the over 100-year history of excellence in rheumatological care at the Brigham and Harvard Medical School. A lot of my talk comes directly from comments and pictures from the book by Matthew Liang on the 100th anniversary of the Robert Brigham, the history of the Robert Breck Brigham Hospital for the Incurables, which Matt wrote for the 100th anniversary of the institution. The Robert Brigham Hospital sits on the top of Parker Hill Avenue, 125 Parker Hill Avenue, and was the first arthritis hospital established in the United States over 100 years ago. It was a combined rheumatological and orthopedic hospital which served the community of Boston and the Northeast for many years. Robert Breck Brigham was the founder of the hospital. He and his sister provided the funds to build the institution. Elizabeth Brigham, as noted here, had a charming personality and a good mind. And one of her great pleasures in the last days of her life was planning the hospital, which she did not live to see erected. The history of the Brighams was that Robert Brigham was originally from northern Vermont and came to Boston and originally worked as an oyster shucker and then set up his own restaurant, the Brigham Oyster Saloon, and that was the basis of his fortune. There were some rumors that the saloon also serviced women of the night, but that was never confirmed. His sister, Elizabeth Brigham, was also quite wealthy and gave one half of her estate to the same trustees as her brother to establish this institution, and the hospital is named in honor of Robert Brigham. So the Robert Brigham left the balance of his $3 million estate to the Robert Brigham Hospital for the Incurables. In February 1903, the hospital was chartered, and in 1909, Elizabeth Brigham left another $1.5 million. Historically, at least 1912, Fenway Park opened. April 1st, 1914, the Robert Brigham opened. And as most of you know, in 1918 and 19, Boston was overwhelmed by the Spanish influenza. We don't know what impact it had upon the Robert Brigham, but I suspect quite a bit. The two plaques that were placed at the outside of the institution were preserved, and it writes the charter was for the Robert Brigham was for the care and support and medical and surgical treatment of those citizens of Boston who are without necessary means of support and are incapable of obtaining a comfortable livelihood by reason of chronic or incurable disease or permanent disability. One of the founders of the Robert Brigham Hospital was a noted orthopedic surgeon, Joel Goldthwait, for which there are still surgical procedures named after him. Dr. Goldthwait's, I think, grandson or grandnephew, Joel Goldthwait, was a prominent rheumatologist and practiced in Boston. He was part of a private practice group that included Arthur Perry Hall. Dr. Hall's father was also one of the founders of the hospital. Donald Holsworth, who is known for his elegant writing about ochronosis. And those three gentlemen worked on Beacon Street and were part of the full-time clinical faculty of the Robert Brigham. This is a photograph of one of the original meetings, if not the original meeting, in the American Rheumatism Association. And in this photograph is Lawrence Swain, who was a member of the Robert Brigham faculty and was the first president from the Robert Brigham of the American Rheumatism Association. There are several very prominent rheumatologists in the photo, including Ralph Boots, Walter Bauer, who became chief of rheumatology at the Massachusetts General, Charlie Short, and others. The first chief of the medical service of the Robert Brigham was Sidney Stillman. I had the opportunity to work with Dr. Stillman during the first year of my fellowship when Sidney was retiring. Sidney was an adult rheumatologist who actually founded the first Center for the Care of Children in the Northeast at the Robert Brigham Hospital. In this photograph, we see one of the tanks that was utilized to provide hot water or hydrotherapy for his patients. And if you look at the patient's knees, you can see clear-cut knee effusions and knee flexion contractures. Additionally, there's deformity of the hands. Dr. Stillman was chief of medicine and was an outstanding clinician and teacher. In this photograph, we see a picture of a young girl with juvenile rheumatoid arthritis on the parking lot of the Robert Brigham overlooking West Roxbury. And you can see the churches in the background. Director of research at the Robert Brigham was Theodore V. Bayliss. Dr. Bayliss was an eminent scholar and clinical researcher. And actually, it was one of his patients that funded the Theodore V. Bayliss Chair of Rheumatology, which is provided to the chair of the Rheumatology Division. The story goes that the man who donated the money was the president of Eli Lilly, who developed a neuropathy and came to see Dr. Bayliss, and at the time that this patient had been on allopurinol, and Dr. Bayliss recognized that perhaps allopurinol could be a cause of his neuropathy. He may have also had cutaneous vasculitis, but that was not confirmed. He stopped the allopurinol and the symptoms improved, and the donor gave the sufficient amount of funds to Harvard Medical School to have an endowed chair in Dr. Bayliss's honor. And this is a picture of Dr. Bayliss and one of trainees using a goniometer to check for flexion contractures. And you look at the patient's hands, we can see clear-cut deformity from their rheumatoid arthritis. And in this montage of photographs, we see on the left-hand side the atrium where patients are sitting, maybe playing cards. Down below is a young girl with juvenile idiopathic arthritis. On the right-hand side, we see a nurse putting splints on a patient with flexion contractures to stretch out their legs. And on the lower picture, we see a therapist working with a patient with severe hand disease. The history of the Robert Brigham, as noted, in 1914, it was opened. In 1941, Brigham House staff rotated through the Robert Brigham. The chairman of medicine at the Peter Brigham was George Thorne, a prominent physician-in-chief, and the chairman of medicine at the Robert Brigham was Sidney Stillman. 1949, the Robert Brigham was the first Boston hospital to use corticosteroids. In 1956, it was the first institution in Boston to receive an NIH training grant for research in rheumatic disease. In 1961, a clinical research center was established at the Robert Brigham, and investigators there reported that aspirin showed a superior effect to narcotics for relief of joint swelling, emphasizing the role of inflammation. 1962, Theodore Potter, who was an eminent orthopedic surgeon, and colleagues focused on joint reconstructive surgery, and the Robert Brigham became a major center for joint replacement surgery. And in 1963, Dr. Stillman established the Clinical Treatment Center for JRA, which was the first center of New England for the care of children. The timeline was that in 1967, Harvard Medical School established a Department of Rheumatology and Immunology that was housed at the Robert Brigham. This is noteworthy because I think this was the only freestanding Department of Rheumatology in the United States. 1972, there was developed an American Board of internal medicine in rheumatology. And in 1980, the Robert Brigham moved to its current site in the Brigham Women's Hospital. The reasons for the movement of the Robert Brigham to the Brigham Women's Hospital is of interest. In 1959, the Dean of Harvard Medical School invited members of the Peter Brigham Board, the Robert Brigham Board, the Boston Lying In and the Boston Free Hospital for Women, as well as Children's Hospital and Mass Eye and Ear Infirmity, to consider construction of a single hospital at the Peter Brigham site. The Robert Brigham Board discussed a formal relationship with Harvard Medical School, prompted by the complexity of Medicare guidelines, patient care, and a nursing shortage. And in 1965, a search committee at Harvard Medical School, under the direction of George Thorne, recommended that Frank Austin, who at that time was an assistant professor at the MGH and chief of pulmonary medicine, to become the first physician-in-chief at the Robert Brigham. Dr. Austin had been a Mass General House officer. He's a graduate of Harvard Medical School. And prior to that, it was at Amherst College. He did a 5-year fellowship in immunology at the Walter Reed Army Institute, and in the UK at the National Institute of Medical Research, and in the Department of Microbiology at Johns Hopkins. One of Frank's first papers was actually on the use of iron lung in the treatment of polio. At the time that Dr. Austin was recruited to become physician-in-chief at the Robert Brigham Hospital, he requested that he be able to hire several additional scientists to form a rheumatology department, and he was given the funds to appoint 2 additional faculty members. John David, who was an eminent immunologist, joined Dr. Austin, and Dr. Austin also recruited Peter Schur, who today remains on our faculty. This is a photograph of Dr. Austin on the left, and on the right is Dr. Austin with the Dean of Harvard Medical School and 2 members of the board of the Robert Brigham. This is a photograph of Dr. Austin and his laboratory, and members of the Robert Brigham core faculty. On the left, we see John David, who founded his own laboratory section. And on the right, we see the young Dr. Peter Schur, and Frank is in the middle. And this is Frank's lab at the Robert Brigham before they moved down to the Sealy Mud. And I can remember some of these people. John, I looked for your picture in here, but I couldn't find it. I mean,
no, I joined there after that.
Oh, you moved when they're down the Sealy Mud. Okay.
Yeah, yeah.
So
there's Jocelyn Sprague. Yeah. Okay.
There's Jocelyn. Yep.
Yeah.
Yeah.
And here's Frank. And I put together a couple of classic sayings of K. Frank Austin. There's a great slide, actually a picture of Frank with multiple sayings, but I took a few of the highlights out. Cut out the editorials and just give the data. Don't take any vacations. This is the best one. If it does not dose response, it is not science. And finally, scientists are expendable. It's the data that counts. And I'm sure for the preclinical and the clinical science group, this is what your lab meetings are all about. I mean, so.
Mike, you forgot the other one. You only get an A for effort in kindergarten.
Oh, that's right.
And how about if you slept last night, you could have done the experiment.
Yeah, that one.
Well, who on this group was in Frank's lab other than me? I don't
You're
think
it,
anyone.
John.
I'm it. There you go.
You're
Yeah.
it. And here's John
Last
David.
survivor.
So John was the one who, discovered macrophage MIF, right? I think that's right.
Yeah.
Yes, yes.
And one of his laboratory mentees was David Trentham, who Simon worked for.
Yes.
So there we go.
He also, John David, Ron will remember this. Was it his father or mother that was a famous French actress?
Deanna Durbin was his
that's
stepmother.
That's right. Okay.
Yeah. Now in this photograph,
Here's young Ron in the background.
there I am, the
All the way in the
Yes.
side. Everybody see
biologist.
young Ron.
And there's what's her name in the middle, the glass washer woman. What was her name? Ron, I think she was your patient.
Alice
Alice
Haratunian, wonderful person.
Artunian, right. And John Spada, is he in that picture?
No,
The rat guy? Okay.
So this is before Gene came up, isn't that right, Ron? I think so.
yeah,
Yeah, look at young Ron though, looking great. And here's young Peter. Jeez.
Way back when.
So Peter ran an ongoing laboratory, which a number of people rotated through. You know, Peter's a professor at Harvard, a master of the ACR, past president, received the Past President's Award from Lupus Foundation. We all know he's a distinguished scientist and clinician, but I know him because he's a phenomenal cyclist, and in the wintertime, we know he's a great baker, and has been really an essential member of the division.
Thank you.
So one of the remarkable things about the Robert Brigham is that we had a dedicated dining room. And Ron actually partake in this like twice a day, actually. There was a doctor's dining room in which the orthopedic surgeons and rheumatologists and radiologists and anesthesiologists met for breakfast and frequently at lunch. And there was a tremendous amount of camaraderie among the physicians caring for these patients. It was a 96-bed hospital. As I noted, it was the first and only arthritis hospital that was set up in the country. Special surgery started as an orthopedic hospital. And at the time, you know, basically there were no DMARDs, so a lot of the care was given for PT, OT, and surgery. And there was a dedicated group of Irish nurses. There was a nursing shortage, and nurses were recruited from Ireland, and they actually lived, their housing was like right around the corner from the Robert Brigham, as I remember. Isn't that right, Ron?
yep,
Yep, they had a dorm. Frank, because he was chairman of a department, and this is really important, sat on the executive committee for Harvard Medical School, which meant that promotion in our department went through Frank. And then Frank had equal stature to Gene Brownwald, Howard Hyatt, Alex Leaf, and Frank Epstein, which gave him a tremendous amount of power, actually, both for promotion and additionally, because we were our own department, we got substantial financial support from the hospital as a freestanding department. And when Frank was asked to step down when he turned age 65, we moved from a department into a division, which has had lasting implications. They merged orthopedics between the Peter Bent, where Drennan Lowell was chief of orthopedic surgery, and the Robert Brigham, and Clem Sledge was appointed chairman of both departments. And this is a picture of Clem, who was from Oklahoma, developed his own total hip replacement, built an extraordinary department of clinical orthopedic surgeons, highlighted by Freddie Wald, Bill Thomas, Marv Weinfeld, Lou Millender, Ed Nailbuff, Dick Scott, and then Tom Thornhill, to name a few. Really remarkable group of surgeons. And here's Clem with a pipe in his mouth, examining somebody's knee. Just really, and this is in his office, actually. And here's young Ron. And
He looks the same.
he does. He's not aged at all. And here's some of his classic phrases. A chance to inject is a chance to cure. Neck pain always gets better. Once you make a diagnosis, you stop thinking. And I just put this in, one of the nicest guys you'll ever meet. And here's
good lupus and bad lupus.
Yeah. And this is Gene Jackson, who I think, Peter, you had a chance to work with Peter, with
Yeah,
Gene
she
before
was
she
in my
died.
lab for 2 years.
Yeah, and Peter Nigrovic, I don't know if he's on the line, but I think Peter had a chance to interact with Jean before she passed away. She came from Baltimore. She went to the University of Rhode Island for undergraduate school and then returned to Baltimore, where she went to medical school at the University of Maryland, where she did her house staff training, and then was the first female chief resident at the University of Maryland, which was really, at that time, remarkable. She went to Boston to do rheumatology, where she was miserable in the laboratory. Is that about right, Ron?
Yeah, I'd say so.
And I'll agree. I'll agree. She was in my lab. She wasn't particularly happy, but she was a great clinician.
Unbelievable doctor.
Yeah.
And then returned to Baltimore to be chief of rheumatology, where I first met her as a medical student. And then she came back to Boston and spent her entire career at the Robert Brigham. She, I think all of us who interacted with her would have to say that she was a consummate clinician and teacher. In fact, the first teaching award for the Brigham House staff is named in Jean's honor. Because she didn't publish, she spent her entire career at Harvard as an instructor in medicine. Yet the fact she trained so many people over the course of her career, really a remarkable person. So
she was important in the Brigham at Children's, and she taught Rob Sundell there, so who became leader of the rheumatology program. And then I trained with her for a month as a medical student, and she's the reason I did both med peds and rheumatology. So really important person in my life.
So
I just want to, can I say
Yeah.
one other thing? Her patients are still asking about her when I see them. It's amazing the effect she had on patients. Just want to add that.
Yep.
So those of us that know Jean well can appreciate that she would have been absolutely miserable with the switch to Epic.
Yeah, she couldn't do her charts.
Yes, she got
couldn't do her charts for
she had a
years.
room full of charts.
And her notes would be,
Walk into her office. Yeah.
she either wrote no note at all, or her notes would be like 7 pages handwritten.
Right.
And in the social history, you would know the name of each one of the cats of somebody. And it was
Kind of
really
free in
pretty
the
remarkable. So in 1968, Frank added allergy to the department and asked his colleague, Al Sheffer, who was a really well-known practitioner of allergy, to join the department. And that's the reason why we end up with the Division of Allergy under rheumatology for some time. One of the great things that Ron did when he, in the early 70s, was that he set up a single center of care for patients with rheumatic disease. The concept of a fellows clinic or a clinic for indigent patients was not part of the Robert Brigham mantra. So you could end up in a waiting room with a millionaire sitting next to somebody on Medicaid. And it really, I thought, Ron, was fantastic that you did that, because many places still had the public clinic. In fact, you go down to New York now, you go to Columbia, for instance, or even special surgery. A lot of those clinics are primarily done by fellows, and they're for patients with indigent care. Ron served as the director of the outpatient practice till 1985, and then I had the opportunity to follow him from 85 to 99, and then John took over in 1999 when I moved on to do ACR activities. In 1977, Frank had the vision to recruit Matt Liang, actually, to establish an outreach and healthcare program. Matt had trained at Stanford with Hal Holman and Jim Fries, and there's a remarkable group of health services researchers in that group. Bob Meenan, who then went on to be chief of rheumatology at BU, and then dean of School of Public Health at Boston University. Claire Bombardier, who all of you know was chairman of rheumatology at Toronto, and Matt, all were in the same year, basically. And Matt set up this remarkable health services program, and Frank had no idea what health services research was, but he knew he needed it for NIH funding for the multipurpose arthritis centers, which the Brigham had the largest running multipurpose arthritis center. And Matt was a crucial component of that, and many of the distinguished people who rotated, who were under Matt's tutelage, are still in our division today, including Jeff Katz, Beth Carlson, Dan Solomon, Karen Cosambeta, and others. I joined the Brigham. I was a fellow in 1978 through 80 and left for a glorious year at Wake Forest for 11 months, 2 weeks, and 2 days, and then came back to the Brigham in 1980 and had a joint appointment between the BI and the Brigham since Gene Brownwald had become chairman of both hospitals, and was fortunate enough to work with a number of colleagues to develop a protocol to look at methotrexate therapy. And I had John Coblyn and Don Holdsworth and Pat Frazier and others see the patients, and we did some preclinical work and some in vivo work, and we published this in 1985, which was the first major research therapeutic study from the Robert Brigham outside of Aspirin. And based upon the success of that paper, I established a therapeutic program in 1985.
Michael, tell them what happened when you submitted the abstract to the ACR, and this was published in the New England Journal.
Yeah, so I sent the abstract into the ACR. It was the first randomized trial of methotrexate, which was in 35 patients, successful, and was the pivotal study for review of the FDA. It got accepted as a poster for the last morning of the meeting, and the poster was next to the restroom, actually, in Minneapolis. When you got an abstract for the last morning of the meeting, which was Wednesday morning, it basically meant that you were probably ranked about the lowest of all the abstracts. And then 2 months later, it got published in the New England Journal. So whenever fellows tell me, gee, my abstract's not going to be a podium, I say, well, join the crowd. It's not unusual.
I hope you saved the poster. I'd love to see it.
Well, we did slides back then. I don't know how we did it. In 1961, there was a discussion of mergers of all the Brighams. One of these consulting groups came in and told the Robert Brigham they can never be successful as a solo specialty hospital. And that's probably not quite so true as you look at the success of the Baptist now and in special surgery. And in 1966, they began to plan things, and they set up what was then termed the Affiliated Hospital Center. And they went to the community. The certificate of need was declined. They went back to the community and finally decided they got approval to build a hospital. And the Peter Brigham had no money. Peter Brigham was bankrupt, actually. And the funding for the Brigham and Women's Hospital, or the Affiliated Hospital Center, came actually from the endowment and the sale of the Robert Brigham Hospital, actually. And there was, at the time they designed the building, there was great interest in having 3 separate towers, one for the Robert Brigham, one for the Peter Brigham, and one for the Boston Hospital for Women and the Lying In. And they selected Bertram Goldberg of Chicago as the architect. Well, I don't think there was a lot of disclosure there, because I think Goldberg had a relative who sat on the board. Isn't that right, Ron? I think that's right.
Yes, that's what I heard.
Yeah. So we were called the Affiliated Hospital Complex, and the first president was Rob Petersdorf. And I think Petersdorf lasted less than a year, actually. And they had a tie with 3 swirls on it to emphasize the equality and identity of the component parts of the AHC. I don't have any of those ties. Maybe Peter or Ron does. And here is his drawing of what was the tower. Isn't it fantastic? It's like a spaceship. And the original tower complex, there was going to be an elevator servicing each of the wings of the tower, but they didn't have any money to do that. So they built just 2 complexes of elevators, and we know what the resultant, how that actually impacted quality of care. Because Frank was physician-in-chief of the Robert Brigham, he wanted the best view, so they put rheumatology on the 16th floor of the Robert Brigham, of the Brigham Women's, and that's where our academic offices were. 16B was our academic office, 16A was our clinic, 16C was the swimming pool, and 16D was rehab. X-ray was on L1, and orthopedics was on A main. We probably lost 25% of our census the year after the move, actually, because for patients, it was an incredibly difficult experience seeing a rheumatologist, getting your X-rays, and then seeing the orthopedic surgeon. It was a disaster. The swimming pool lasted, I don't know, maybe 5 years, I think, and then was covered over. And then, as I mentioned, we lost our inpatient service when Medicare would no longer pay for RA. John David left the department in 1992 when he was given a professorship in tropical health and moved over to the Harvard School of Public Health. And the research labs were at the Sealy G. Mudd building initially, And then the medical school offered Frank a deal because they wanted the Sealy G. Mudd to be back, and moved him over to the Smith building. And that lasted maybe 15 years. And then the Farber threw us out of the Smith building into what now is the Hale building. So I want to end up with kind of the legacy of the Robert Brigham. We've had 6 members of the Robert Brigham, either faculty or fellows who have subsequently gone on to become president of the ACR, starting with Lorem Swain, Sid Stillman, Sean Ruddy, who was in Frank's laboratory, president of the ACR. I had the pleasure of being president 20 years ago, and now Ellen. Had 2 presidential gold medals come out of the Robert Brigham, 3 distinguished clinical investigator awards, 4 basic investigator awards, 1 clinician scholar award, 9 Kunkel awardees, which is the largest of any group, 19 masters, which is the largest of any rheumatology program, 2 fellowship director, 4 Pauline Phelps award winners, and 1 excellence in investigative mentoring. Really is a remarkable group of awards coming out of people who have been associated with our institution. And we currently, and this needs to be updated, I think we have over 61 rheumatologists, 14 postdocs, 6 to 9 rheumatology fellows. And I don't know what our current funding is. This was as of 2 years ago, it was $18 million. Over 40,000 rheumatology ambulatory visits, 3 Harvard endowed chairs, and 5 Brigham endowed chairs. So, really, and we have more endowed chairs than any division of medicine actually right now. So I want to end up with the legacy. I mean, we think about rheumatology. We work, in the new Hale building, but our tradition actually dates back, over 100 years ago to this building, which, I think the principles of the Robert Brigham still continue today with excellence in patient care, outstanding research, and friendship and camaraderie among the rheumatology faculty. And this is a picture of camaraderie. This is the bike group I'm in. We actually now Skype every morning at 6:30, and then we bike. We still bike, but we've now take social distancing. We only will bike 2 guys at a time now because of the data that's coming out now, droplet flow when you bike actually. This is a picture taken on the backside of Glacier National Park when we did Highway to the Sun. So I'm into there and happy to answer any questions. Thank you.
Thank you for putting that together.
Yeah, that was
really
great.
Interesting.
Can you email those slides out, Michael?
Yeah, happy to. Who do I send them to? You, Jeff? You can be the.
Yeah, that'd be fine.
Okay.
I'm recording this for posterity. I don't know if you caught that.
There we go.
Mike, this is Cheng. Could you tell us about the Peter Brigham? I mean, you mentioned Robert more, but I always kind of a bit confused about these 2. I know they are brother, but what?
Well, I know they didn't like each other. And I don't know where Peter got his money from. I don't know whether Ron or Peter have any idea about that.
Yep, I was told that they worked considerably in what was called traffic. And the question always is, what does traffic mean? That means traffic in women.
Right. There was always this rumor that the Oyster House was basically just an allowance for women of the night to come through. And one of the things that was said is that Robert and Elizabeth didn't have fond feelings regarding Peter, so they built the hospital to look down on him.
Michael, can you also comment on the Brigham name? I've heard that there is a relationship to Vermont, i.e. Brigham Young, and the Mormon movement. Is that true?
No.
Not that I'm aware of.
No.
No.
I don't think so.
No, that's not true.
Okay.
But
All
I
I
will
can say
tell
is
you when
Michael, tell them what happened when you were interviewed on
Yeah.
Today.
Yeah, so when I was interviewed on Good Morning America, I can't remember who was the
Charlie
woman
Gibson.
who introduced me as Dr. Michael Weinblatt of Brigham and Young Women's Hospital.
Yeah, right.
I mean,
Right.
Brigham Young
I know
Hospital.
that when my son Seth broke his leg in 1998 on a ski hill in Alta, Utah, I had to call the hospital with his health insurance. And as soon as I said he's covered by Brigham and Women's Hospital, I could feel this cloud through the phone line that I am royalty, that I must somehow be related to the Brighams. And he had like the most VIP experience after that. I did not dispel the myth.
Mike, there was something which you mentioned, and I thought I would just comment further about care back at the old Robert Brigham, in that when people actually developed rheumatoid arthritis for the first time, they were admitted and they stayed for about 5 days' time. And so actually one may question, why should you admit someone to the hospital when they've got rheumatoid arthritis? Well, they usually lived in a ward that there were 3 or 4 beds, so people would beat each other. There were some wonderful Irish nurses who used to come in the morning and go and apply hot fomentations and hot packs, and often we'd inject them. We would start them on full doses of aspirin, and patients, for the first time, felt that there was some hope. I mean, we didn't cure many people, but there were many patients that I'd follow for 30 years would tell you that, that original 5 days was so very, very important to them, because that was the first time that they felt someone was interested in them. I think most of us don't remember that when Peter and I and John and Mike went into the field of rheumatology, it was sort of a kind of an obscure specialty of medicine. There actually weren't many rheumatologists. There were 5 states within the country that didn't have one single rheumatologist. And so just to be exposed to people who cared about them, and if they felt 1/3 better after this event, then that would carry them often for years and years. Plus you could kind of talk to them over the phone, and I just thought that it was a great value, even though it's not very practical from dollars and cents.
I should mention about X-ray. Leland Sossman was the bone radiologist, and his protege was Barbara Weissman, who started at the Robert Brigham, actually, and Barbara went on to become, internationally renowned bone radiologist. They had incredible skill in skeletal radiology.
The one thing I'd like to add.
Can I ask about the history of the Brigham and the Brigham name? So when I first came across the Brigham and Women's Hospital name, I was an editor of a college paper, and I circled it and said, this can't possibly be the name of a hospital because it's such a funny construction. So how did that come to be, Brigham and Women's?
Well, the story,
merger.
Mike, you want to give it?
No, you can give it, Peter.
Okay, so originally it was called the Affiliated Hospital Center, and everybody had difficulty with the name, but finally the taxi drivers solved it, because when patients said, take me to the Affiliated Hospital Center, the cabbie would say, oh, you mean the Brigham? And so finally the Board of Trustees changed the name. That's the story I have.
And they had to have
I
women
also
there
think
because
the other
they
issue was that they hoped that someone would step forward, with $50 million, $100 million and give it to the institution, and it would be called the Johnson Hospital or, something like that. And after a couple of years, no one came forth with a, huge donation. So because they had 2 Brigham and then they had the line in and the Women's Hospital, they just went and combined the names.
It was a committee meeting that took weeks to resolve between representatives of the Peter Brigham, Robert Brigham, and Boston Hospital for Women. I was on that committee, and we finally compromised on those 3 words.
Something else which I thought was of interest was that actually back in 1977, when they were planning on how to build the new hospital, I was in one of the committees involved, and I said, with a 16-story bed tower, the elevators are going to be critical. And we need high-speed elevators. We need a lot of them. And we were told that we have the best, actually, elevator consultants in the world. You will never wait more than 20 seconds for any elevator. You never be more than 2 minutes away from any floor. And I just think having a 16-story thing, I mean, often you wait 2 minutes for an elevator. You could be 5 minutes away from the floor. And I think it's really had a negative effect on the hospital.
Yeah, the original design was for 8 elevators, but the Boston City Council, with its chairwoman, vetoed it and said you're only going to get 6 elevators, and that's why we're stuck with slow service.
Well, they also didn't have any money for any additional elevators because they were basically bankrupt.
Yeah. But the 2 things I also remember about the Robert Brigham is that for Christmas and New Year's, patients were always served champagne. And the other thing, Mike, that you might remember, also for New Year's, we had a celebration with the Board of Trustees, and they always served the best shrimp.
Yeah, there was an event called At Home, which the spouses of the physicians, the medical and orthopedic staff set up. And it was the trustees and all the healthcare providers with open bar and shrimp. It's actually a lovely event, actually.
That was one thing about the camaraderie, and it was really enhanced, as you mentioned, sitting in a cafeteria for lunch. Both orthopedists, rheumatologists, and the researchers all got together and shared. I see you're wearing your Robert Brigham tie.
I did. I decided to wear a shirt and tie because I haven't worn a shirt and tie for about 3 weeks, and I don't think I'll be wearing another one for 2 months.
Yeah.
I thought I'd wear it for this.
You don't have to wait for the elevators either.
Well,
Mike,
great.
that was wonderful. Thank you very much.
Mike,
Mike.
thank you.
Great.
Terrific.
Thank
Be
you.
safe, everybody.
Thank you.
Bye now.
Bye.
Bye, thank you.